A key federal vaccine advisory panel meets today, September 19, 2025, to consider a dramatic change to one of the most successful childhood immunization policies in United States history, the timing of the first hepatitis B shot. For more than 3 decades, every newborn has been recommended to receive that first dose within 24 hours of birth. The practice has nearly eliminated the disease in American children. Now the panel is debating whether to push that shot back until a child is 4 years old. To see why this matters, it helps to understand the virus itself. Hepatitis B attacks the liver. Over time, it can cause cirrhosis, liver failure, and cancer. It is extraordinarily contagious, about 100 times more infectious than HIV, and can survive on surfaces for up to a week. Adults who contract the virus often clear it. Infants rarely do. Roughly 90% of infected babies develop lifelong chronic hepatitis B, and about 1 in 4 of those children will die prematurely from liver disease. In 1991, the Centers for Disease Control and Prevention recommended the immediate birth dose vaccine as a safety net. Back then, an estimated 18,000 United States infants were infected each year. Today, the number is measured in double digits. The vaccine works because it blocks the virus at the moment of highest risk, during and shortly after delivery. Most infections are passed from an unknowingly infected mother, but the virus can also move silently through household contact. Shared toothbrushes, razors, or even a microscopic speck of dried blood can do the job. Many carriers feel perfectly healthy and may not know they are infected. The new proposal comes from a newly appointed Advisory Committee on Immunization Practices, or ACIP. All 17 previous members were dismissed and replaced by the incoming Health and Human Services leadership, including Secretary Robert F. Kennedy, Jr., who has publicly questioned the need for a birth dose. Supporters of the delay argue that hepatitis B is usually linked to adult behaviors, such as sexual activity or needle sharing, and they say a 1-day-old baby faces virtually no immediate threat. They also want more time to test mothers after delivery and obtain explicit informed consent before vaccinating infants. But mainstream medical groups warn that any delay opens a dangerous window. A mother tested early in pregnancy could contract the virus later. Another family member could be an unwitting carrier. And once a family leaves the hospital, follow-up appointments can be missed, especially in communities with limited access to care. Pediatricians liken the current schedule to a seatbelt you click before starting the car. The protection has to be there from the first moment. Critics also point out that no new scientific evidence suggests a problem with the existing policy. On the contrary, it is one of the clearest public health victories on record. They worry that undoing it could reverse decades of progress and invite a resurgence of a preventable, life-threatening disease. The hepatitis B debate is only the latest sign that the reconstituted ACIP is steering United States vaccine policy in a new direction. Just yesterday, the panel voted 8-3 against using the combined measles, mumps, rubella, varicella shot for children under 4, recommending separate injections instead. Today's vote on the newborn hepatitis B schedule, originally slated for yesterday but postponed, is being watched especially closely. Although ACIP recommendations are not final until accepted by the acting CDC director, they shape pediatric guidance and state school requirements nationwide. Whatever the outcome, the decision will send a clear signal about the future of American vaccine policy, whether it continues to rely on the early universal protections that have kept once common childhood diseases at bay, or shifts toward a more selective, risk-tolerance approach. For parents, pediatricians, and public health officials, what happens in that committee room today could determine whether a cornerstone of infant disease prevention remains intact, or whether the nation risks reopening the door to a virus that once claimed thousands of young lives each year.